Good evening. Welcome to this month's Town Administrator's Report. I'm David Watts Jr., and with me is our Town Administrator, Steve Maio. Welcome, Steve.
David, how are you?
Doing okay. How are you?
Oh, living the dream.
And joining us this month is someone who's new to Wakefield Town Government, Anthony Chui, who's our new Health Director. Welcome, Anthony.
Thank you so much.
I had a chance to look through your resume getting ready for the show this evening, and it's really quite impressive. Tell us a little bit about your background that made it possible to come to Wakefield.
Sure. So thank you, everyone, including Steve as well. So my background, I'm an epidemiologist by training. I have a lot of experience working as a public health specialist, and a lot of my background actually focuses on infectious diseases. And so we do a lot of pattern tracking, and we do a lot of contact tracing as well. So a lot of the background I have is actually working in that realm. I've experienced working in substance use prevention as well as mitigation as well. I've also worked a lot during COVID as well as an epidemiologist that has worked with the state level and other community partners as well to figure out the best ways to do contact tracing and testing. And hopefully I want to bring in some of my experience in substance use and mental health understanding to the town of Wakefield.
Fantastic.
I want to say we are thrilled to have Anthony on board, and brilliant is probably an understatement. Anthony, epidemiology, I think that's on the tip of everyone's tongue, and hopefully we get through, we get through this wave or the next wave, and epidemiology won't mean as much. Let's hope that happens.
Yes.
But one thing that also struck me in your resume was your work with autism. Could you just give a little thumbnail on that? Because I thought it was fascinating myself. And I think there are many families in Wakefield, Melrose, because it's a joint position, across Massachusetts, across the country, that really struggle with, people in the family that are on the spectrum. So if you could give us a little brief, I found it fascinating, and that's kind of why I'm asking you to maybe give a little brief info on that one.
Absolutely. So I've had the great pleasure to really work with a lot of professionals in the mental health realm. And one of the topics that we've worked on was autism. And so we used kind of novel technique. It's called fMRI. It's a technique that allows us to do simultaneous brain activity tracking. And so that's between social interactions between a person that is designated as a normal functioning individual, and then someone that is on the autism spectrum. And so we are able to have simultaneous interactions, and that's through computer training as well as face-to-face interactions. And we really wanted to see which areas of the brain are at work during certain types of tasks. And then so that helps us gain a better understanding of which tasks we can actually help with moving forward, and really begin to understand more of a deeper understanding of how autism affects social interactions for people who are on the autism spectrum. So a lot of our work revolved around brain activity tracking, and we also looked at eye tracking movement as well. And so the data that goes with the eye tracking data actually shows us how much time individuals spend during a social event looking at each other, direct eye contact as well as eye contact with the task they're doing. And so this is actually kind of a proxy measure as to how individuals, how comfortable they are in social interactions, as well as, in everyday life, how they will go about these, normal tasks. And so this gives us a better understanding of, what they struggle with and to what severity. And this really helps us really understand, what treatment is best for them moving forward. And this kind of adds to the body of literature out there that is surrounding this.
Yeah, I think that as we continue through, providing health services to our community, I think that mental health is something we really, and I think Wakefield's done a really good job on this overall. We need to do a lot more, and something that I look forward working with you and the Board of Health on, hiring, more social worker support for people and families and children. And I think as we come out of this pandemic, it really is so necessary for everybody. So I think your epidemiology work and your mental health work is what a fit for us. So we're very, very lucky.
Well, and it builds on, and we've talked about it before, actually, a few shows ago with Chief Scory. It builds on the changes that have been made within the police department with respect to mental health issues, family issues, that are more positive than they had been 20 or so years ago.
Night and day, yeah.
You know, so something really to look forward to. But let's talk a little bit about where Wakefield is right now with COVID. We're in the middle of another surge with the Delta variant, but this time with the added benefit of vaccines being available. As of mid-September 2021, where is Wakefield right now in the big picture of the pandemic?
Yeah, so Wakefield, compared to surrounding areas as well as the rest of Massachusetts and the country as a whole, Wakefield has done an amazing job to really come together as a community and understand the benefits of vaccines and as well as testing. And so Wakefield, I believe in the last week or so, has been averaging about 5 new cases per day, which is actually quite low for our area here. And one of the things I wanted to stress was, even though we have these low rates, what we're seeing across the country is many individuals, especially unvaccinated individuals, that is the main population that is being seen in hospitals with severe disease. And so one of the things that we're very lucky here in Wakefield that we have the robust testing, the vaccination, and it's possible to have access to all these things so easily here. One of the things we wanted to stress is, we're not immune to the rest of the nation's issues. And so we have to remain vigilant here in Wakefield. We have to continue to get those who are, possibly hesitant about the vaccine. We want to make sure that the right information is out there for them to make the right decision. And so we want to continue to make sure that we have consistent testing rates. We want to make sure that contact tracing continues to be very strong here, and that we continue working with our schools as well. Our school system, we have a great superintendent, Doug Lyons. He has done a great job working with the school nurses to really make sure that our children are safe in the school system. There's a very strong contact tracing program going on within these schools. And so we are able to make sure that parents understand that we are doing everything we can to help them, manage this while also, not allowing, children to fall behind in our school system. So with COVID, there was a hiatus in terms of students being in the classroom, and there's been national data to suggest that many students have fallen behind. It's very difficult, in that virtual learning environment for them to maintain this level of education. So we are doing our best to having that balance for keeping children in school, but also doing it safely. So if we're looking at the data, so we're averaging about 5 new cases per day. I believe in Wakefield we are at 86 active confirmed cases right now. And if we're just looking at the vaccination rates by age group, we can see that we're having a great response. We're at over 80% in a lot of our age groups, over 30 to 49 years. The age group that is a little bit lagging in terms of the vaccination rate has been that 20 to 29 year age group. And so a lot of that has to do with the messaging that we're working on. And we really want to make sure that individuals have the right information to make that decision for themselves. We have lots of evidence to suggest that vaccinated individuals have less severe disease if they are unfortunate enough to contract COVID. But to maintain that capacity in hospitals for other diseases and other conditions where we can treat them, we don't want our systems to fill up with cases from ICU for COVID. So we want to make sure that individuals are aware that they're doing their part when they get vaccinated to protect not only themselves but others.
Yeah, our 20 to 29-year-olds are around 70% have had one shot. It's inching up slowly every couple of weeks when the state gives the data out. But I think we're going to not only messaging, we're going to try to bring the vaccinations to them. So the town has an event Saturday first, I'll call it a mini Oktoberfest beer garden on the Common. And, my mantra is get a shot in a beer and get down there. And there will be vaccinations available through our partnership with Cataldo Ambulance. And
Right.
I'm hoping that, a big percentage of those that get vaccinated, and it's open to anybody, you don't have to be 20 to 29. Anybody who wants to get a shot can get down there.
Well, these will be, at least according to the article last night in the item, these will be first shots
First
of
shots.
the Pfizer
Yes, I believe
vaccine.
Pfizer is what we're gonna be receiving
Yeah.
for that one.
Yeah,
It's, it is like Anthony said, it is the right thing to do for your neighbors, your country, your grandparents, your parents, if you don't have kids yourself, your nieces, your nephews. I mean,
Right.
it really helps.
right.
And I think nationally, if you have had your 2 shots, I think there was a statistic I saw this morning or last night on the news. The cases of illness are, for those that have had both their shots, is of serious illness is so small. It's so tiny that I don't know. I kind of don't understand why you wouldn't protect yourself. But
Plus there's one September 23rd, which is tomorrow evening, 3 to 6 at the high school field house.
right.
This is a second shot for those who received theirs on August 26th and September 2nd, but they will also make first shots available too.
Right, and hopefully for the second shots, these are a lot of families, people that came in registering for school or getting back to school, and again, trying to go where the people are. So those were some 2 nice events, and we had for the earlier shots. So hopefully people come back and take the time to get their second. It takes 15, 20 minutes. You're not going to have the long, crazy lines that
Right.
we had before. So
But the other thing also is we're getting into flu season.
yes.
And so there are 2 coming up, 2 flu clinics. Saturday, October 2nd at Festival by the Lake. There's going to be a flu clinic there. And Thursday, October 21st from 4 to 6 at the Galvin Middle School. Cataldo Ambulance again will be helping out by conducting a drive-through flu clinic at that.
Yeah, and I think maybe Anthony can talk about the importance of the flu shot in conjunction with your COVID shot.
Yeah, because it isn't just COVID,
Yeah.
especially this time of the year. So let's talk a little bit about the flu. If I understand correctly, it's a multi-flu shot this year.
Yes, that is correct. So with the multi-flu shot, we're hoping that it'll cover multiple strains. And one of the things that we wanted to make sure that the town of Wakefield understands is that, with less cases of flu, we're at less risk of, hospitalizations due to the flu. And so this could help alleviate some of the issues when we have other COVID cases coming up. And inevitably, now that we're entering the fall and winter season with everybody being indoors, there will be some additional COVID cases that we're not seeing during the summer. And so one of the things we wanted to stress in terms of these flu clinics is that by coming to get the flu shot, you're not only protecting yourself by avoiding the respiratory dangers of having the flu, but also you're protecting all of your loved ones, all of your friends, anybody that you come in contact with. This is really about protecting everybody in our community as we still navigate this kind of second wave of the pandemic. And by doing so, we can really prevent more COVID cases in the end.
Very important.
Let's talk, we've kind of covered COVID at this point. Let's talk about some of the other, you touched on mental health issues. Let's talk about some of the other health department issues that people of Wakefield need to be at least aware of.
Sure. So during this pandemic, a lot of the issues that we've been working on and kind of in the background have fallen off a little bit. So we really want to invigorate these efforts. One of the issues that we want to address very strongly is substance use. And that's in schools and that's among the youth as well. We have a very, very robust program here, the Youth Action Team here in Wakefield. And so they do really great work with messaging And they really allowed the youth to drive the conversation forward in terms of substance use and understanding where the patterns are headed now. And because they have that connection with the youth, they can actually speak peer to peer and really be effective in messaging about the dangers of drug use, and also really then being able to communicate with parents as well, what they can do on their part to help with this as well. Mental health is also one of those things that cannot be completely separated from the pandemic, as well as substance use. Mental health is something that is a priority here in our health department, and we have very, very strong staff and programming that we're hoping to implement moving forward. There's already some going on right now, but we're working with our schools as well as the community to understand what resources are out there, and we want to make these available for individuals. So due to the kind of unprecedented isolation that was resulting from the pandemic, a lot of people now are coming back out and they're experiencing issues with anxiety, due to isolation, and they're nervous about interactions with individuals again face to face. And a lot of these issues are now compounded because people are going back to work, their children don't have that, maybe consistent support system at home at all times. So we want to make sure that we have those resources out there, and we want to make sure that the community understands that there are, that we are there for them.
Mm-hmm, mm-hmm.
Yeah.
And, this feeds into other issues like cigarette use, vaping.
Yes.
We have quite a fewer vaping stores in Wakefield now than we did a year or so ago. But, what other challenges do you see on the horizon, in addition to what you've already brought up, that the health department will get involved with under your leadership?
Sure. So one of the most interesting issues, I think, moving forward that are outside of substance use and outside of mental health, but not completely unrelated, is the use of screens and media. And so a lot of kind of the modernization of our health department now is moving forward, understanding the impact of media on misinformation, as well as impacting youth on certain trends. And so we have some understanding of how certain trends on media platforms such as TikTok and other places have kind of now manifested in our daily lives. And there's youth out there going to do these trends or these things they see online, or then believing certain things they read online about issues that may have more credible sources, especially about COVID. So one of the things that we're hoping to move forward in is understanding that kind of virtual space that we all live in now. And so really understanding how to identify reliable information, as well as resources to possibly talk about what misinformation is out there and clarifying miscommunications. And so really the expansion of the youth action team into that space is going to be something that we're looking into. Social media is going to be a part of our lives no matter what moving forward, and it's better for us to really understand that now and get a good grasp of it before we move forward and there's less information. So.
Mm-hmm. Mm-hmm.
Yeah. I'd say it's probably not just the youth that are going on these crazy sites and getting misinformation.
If Facebook is any indication, but there have been indications in some media reports of the last few days going back to COVID that the view is that COVID is starting to, I don't want to use the word dissipate because that's not correct, but we're looking at a gradual improvement over the next 6, 8, 10 months, compared to what people have been experiencing for the last 18 months.
Yeah, year and a half.
Sure. Pretty close. At what point will it become apparent to people that things are opening up again, that things are coming back to some level of normalcy?
Sure. So really the greatest tool we have to approach that normalcy that you've just mentioned is vaccination. I mean,
Mm-hmm.
that's the one protective factor that we can do. We have multiple layers of protection already in place. We have masks, we have social distancing, we have a lot of these programming tools that we use. But at the end of the day, the vaccination rates is what's going to drive us and really push us through this pandemic. And once we reach that level of very high vaccination rates, then we can safely go out, and enjoy our social activities without having to worry about COVID kind of lingering in the background. And so the sooner we can do this, the better. As we approach the colder months, we're all going to be kind of cooped up inside, and this is just the recipe for, viral spread. And so we want to make sure that we make that final push kind of coming into the fall and winter that, we can get those vaccination rates up, and we can now prepare for the possibility of a booster shot. And so there's been a lot of national coverage about the booster shot and the FDA and CDC working through this realm. And so one of the things we've been talking about is having your booster shot is great. We want to make sure that individuals are protected to the highest amount that they can be. But for those who are unvaccinated, they are still posing a risk to themselves as well as those around them. And so we want to make sure that is the one thing that we want to push.
Well, and part of that is overcoming the misinformation.
Right.
And making people understand that some of the things they've been told aren't necessarily true. That it is good to get stuck with that needle twice.
Yes.
What do we think is, if you can put a number on it, and probably an unfair question, what is that level of vaccination where you can achieve herd immunity? And I think we ought to look at this globally. I mean, we know that certain areas have a much lower level, than we do in the Northeast.
Right.
So what does the science say? Is it?
So the science says that, in diseases that are similar to COVID in their spread and their transmission rates, 80 to 85% really across the board is the kind of threshold that we're hoping to get to. This is irregardless of age group. So this is, we need everybody, to contribute and to reach this 80 to 85%. And really to fully understand some of the nuances with this is that, that 80 to 85% is sometimes not by choice. That we have, individuals that are immunocompromised or are not eligible to receive the vaccine. And so what we're doing with this 80 to 85% vaccination rate is really protecting those that can't get the vaccine. And so by doing this, we can really lower the level of the disease and prevent something that, biologically speaking, if we allow this virus to propagate for long enough in our unvaccinated populations, we're going to eventually see, a virus that may be more highly transmissible, possibly more deadly. And we want to make sure that this is not something that we're harboring and that we're not trying to contribute to this case. So really, the 80 to 85% threshold is what we're looking at right now.
Right, and that is more difficult in certain areas than others.
Yes.
So that's the real challenge.
Yeah, that's one of the fortunate things. Living in New England is in pretty good shape as a region.
Right.
Which is good too. The other factor that's coming down the pike, and we've heard some news about it this week, is expanding vaccinations to those kids under 12.
Yes.
And hopefully that'll happen in the next 6 or 8 weeks. Does that look to be a good prospect, and is that something that you as the health director would recommend doing as part of the school department itself? And I raise that because you might not be, but I'm of the age group that we had polio vaccinations in school when we were students. And
you had vaccinations?
it was the first.
Okay.
It was the shot first, and then it was the
drink.
liquid.
Okay. Yeah. I'm much younger. I remember the drink. So.
And I remember the shot. And it was part of the school program. The school nurses administered it, and that was that. Is that something that the health department would be looking to do?
Absolutely. In terms of vaccination, we definitely have trust in the organizations that are doing the work. So FDA has, once they give our approval, we know that they've gone through these strict protocols, and they've done the research to make sure that it is safe for these age groups. And so we want to stress, to the parents and to the community leaders and to everybody in the community that we don't make these recommendations lightly. We take a look at the science. We make sure that everybody understand that this is a safe option. And so then we want to work closely with our trusted community partners, and that's the nurses and, everybody else that's administering. We want to make sure that they're doing the vaccinations and getting that messaging out there with us, so that students and parents feel safe having their children vaccinated against this very deadly disease.
Mm-hmm.
And I think another thing is when I'm questioned, as we all are as town officials, consult your physician.
Right.
I mean, you have a pediatrician, should consult your pediatrician if you have any doubts. I mean, that's what you should do on anything, right? So
Right.
I think that's very important that, the public does do that, because I think it is scary for parents. I get it, I don't dispute that, but talk to your physician.
But one thing, and I don't think it's been given enough attention in press reports, this is not a vaccine that was cobbled up in a matter of weeks or
Right.
months. This was the result of 40 years of research that made it possible to do it as
Right.
quickly as it was done. There's a lot of work that went behind even making these vaccines possible. Without which we would have been years before a vaccine
Right.
was made available.
And one of the things I wanted to say is that I'm glad you made the recommendation. So always please speak to your physician before, if you want to make any decision. But also, if you have any questions about research, please feel free to reach out. I mean, I am more than happy to, and we have great staff at the health department as well. We are more than happy to sit with you and really talk through some of the research that you'll be looking at and how to identify sources of credible sources. And we want to make sure that people have access, to resources that will help them in their decision making, because there's a lot of misinformation out there, and the way to combat it is really to identify sources of credible information. So.
Absolutely.
Anthony, thank you very much
Thank
for
you.
joining us. And if there's any important changes or developments in anything that the health department handles, let us know, and we'll do a follow-up show, as it's necessary, so people can get the right information.
He's certainly hit the ground running, I'll tell you that.
Absolutely. Couple of housekeeping things before we close. We have regular town meeting coming up.
Saturday, November 6th, here at the high school, at the Charbonneau Field House. There'll be the same as the last 2 or 3, inside and outside. For those of you who are a little bit uncomfortable coming inside, we're going to accommodate that with an outdoor availability. It will be heated, like we have in the past, so that'll be there. That's Saturday morning. You never know until the warrant is closed, but it looks like 10-ish articles. So
Right, which will
hopefully-
actually be the subject of the next show.
next show we'll go through each one.
Yep. And anything else coming up within the next month that maybe the townspeople should know about?
I know we do have the clinics we spoke about.
Right,
for
and
both,
those will also be
Yep.
up on the show so
Right.
people can see the
both
text.
for vaccines, for the coronavirus, and for flu shot, which is very important as well. Let's not neglect that. One doesn't cancel the other.
Right,
You need to get them both. And the Festival by the Lake is coming up. We're trying to go, like I said, where people are. So hopefully there'll be some nice outdoor events that you can socially distance, get some fresh air, get your exercise out there before we are, like Anthony said, kind of huddled back into the
stuck
winter
inside for the winter.
in front of the fireplace or in front of the heat lamp or whatever.
Anthony, thank you for joining us. Welcome to Wakefield. Steve,
Yep.
thank you.
Thank you.
Thank you so
And
much.
thank
Thank
you.
you.
See you next month.